Welcome back. This is Dr. Srujana again, presenting another new topic from public health. So today's topic is significant events in the history of public health. History provides a perspective to develop an understanding of health problems of communities and how to cope up with them. We visualize through the eyes of the past and how societies conceptualized and dealt with the disease. All societies had to face the realities of disease and death and develop concepts and methods to manage them. So let's discuss today all the events in a chronological order. So starting with the British India, in the year 1757, the British has established their rule in India. Civil and military services were established. In the year 1825, the Quarantine Act was promulgated. In the year 1835, the establishment of Calcutta Medical College was done. In the year 1859, the Royal Commission was appointed. The Commission recommended the establishment of Commission of the Public Health. In the year 1864, the sanitary commissioners were appointed in the three major provinces, Bombay, Madras and Bengal. In the year 1869, a public health commissioner and a statistical officer were appointed by the Government of India. In 1873, a Birth and Death Registration Act was promulgated. In the year 1880, the Vaccination Act was passed. In the year 1881, the Indian Factories Act was passed. First Indian census was taken. In the year 1885, the Local Self-Government Act was passed. In the year 1888, the Government of India directed that sanitation should be looked after by the local bodies. In the year 1896, an epidemic of plague occurred. The Plague Commission was appointed. Establishment of Indian Medical Services was also done. In the year 1897, the Epidemic Disease Act was promulgated. In the year 1904, the Plague Commission in its report recommended that the organization and expansion of public health departments had to be reorganized and the establishment of laboratory facilities for research, production of vaccines and sera. In the year 1909, the Central Malaria Bureau was founded at Kasauli. In the year 1911, the Indian Research Fund Association, currently called as ICMR, was established for the promotion of the research. In the year 1912, the Government of India decided to help the local bodies with grants and sanctioned the appointment of deputy sanitary commissioners and health officers. In 1918, the Nutrition Research Laboratory was established at Coonoor. In the year 1919, the Montague-Chelmsford constitutional reforms led to the transfer of public health, sanitation and vital statistics to open the provinces under the control of an elected minister. This was the first step towards decentralization of health administration in India. In the year 1920 to 1921, the Municipality and Local Boards Acts were passed in several provinces. Coming to the year 1930, All India Institute of Hygiene and Public Health at Calcutta was established. The Child Marriage Restraint Act, the Sarda Act, came into effect fixing the minimum age of marriage at 14 for girls and 18 for boys. In the year 1931, a Maternity and Child Welfare Bureau was established under the Indian Red Cross Society. Coming to the year 1935, the Government of India Act revitalized the 1919 Act, giving greater autonomy to the provinces. All the health activities in the country were grouped in three lists: federal, concurrent and provincial. Coming to the year 1937, the Central Advisory Board of Health was set up with the Public Health Commissioner as the secretary. Coming to the year 1939, the Madras Public Health was passed. The first rural health center was established at Signur, near Calcutta. The Tuberculosis Association of India was established. Coming to the year 1940, the Drugs Act was passed. Coming to the year 1943, the Health Survey and Development Committee, the Board Committee, was appointed by Government of India. In the year 1946, the Board Committee submitted the report. Now, let's discuss about post-independence era and how the things were developed in our country. In the year 1947, the Ministries of Health were established at the center and the states. In the year 1948, India joined the WHO as a member state. Employees State Insurance Act 1948 was passed. The report of the Environmental Hygiene Committee was published. In the year 1949, the Southeast Asia Regional Office of World Health Organization was established in New Delhi. The Indian Research Fund Association was reconstituted into Indian Council of Medical Research. The Constitution of India came into the force in 1950 and India became a republic. The Planning Commission was set up by the Government of India. Coming to the year 1951, the first 5-year plan began. BCG vaccination program was launched in our country. So I guess every one of you are aware of BCG vaccination, right? BCG vaccination is given against tuberculosis. It builds resistance against the bacteria. Now coming to the year 1952, Community Development Program was launched. In the year 1953, the National Malaria Control Program commenced as a part of the first 5-year plan. The National Extension Service Program was started. A national-wide family planning program had also begun. A committee was appointed to draft a Model Public Health Act for the country. In the year 1954, the Central Government Health Scheme CGHS started in Delhi. The Central Social Welfare Board was set up. The National Water Supply and Sanitation Program was inaugurated. National Leprosy Control Program had started. VDRL antigen production was set up in Calcutta. The VDRL antigen production has started against the disease syphilis. So coming to the year 1955, the National Filaria Control Program has started. The Central Leprosy Teaching and Research Institute was established at Chengalput, Madras. A Filaria Training Center was established at Ernakulam, Kerala. The Hindu Marriage Act prescribed the minimum age for marriage 18 for boys and 15 for girls. The National Tuberculosis Sample Survey commenced. In the year 1956, the second 5-year plan started, that is, the year 1956 to 1961. The Model Public Health Act was published. Central Health Education Bureau was established. The Demography Training and Research Center was established in Bombay. Tuberculosis Chemotherapy Center was established in Madras. The Immoral Traffic Act was passed. The Trachoma Control Pilot Project was established. In the year 1957, influenza pandemic swept the country. The Demographic Research Center was established in Calcutta, Delhi and Trivandrum. Coming to the year 1958, the National Malaria Control Program was converted into National Malaria Eradication Program. The Leprosy Advisory Committee of the Government of India was constituted. A 3-tier structure of local self-governing bodies from village to the district was recommended for dispersal of power and responsibilities in the future. The National TB Survey was completed by the year 1958. Now coming to the year 1959, Mudaliar Committee was appointed. Panchayat Raj was first introduced in the state of Rajasthan. The National Tuberculosis Institute was established at Bangalore. The Nutrition Research Laboratory at Kunur was shifted to Hyderabad. Coming to the year 1960, the School Health Committee and National Nutrition Advisory Committee was constituted. The pilot projects for smallpox eradication had begun. The third 5-year plan from the year 1961 to 1966 was launched. The report of Mudaliar Committee was published. The Central Bureau of Health Intelligence was established. Coming to the year 1962, the Central Family Planning Institute was established in Delhi. The National Smallpox Eradication Program was launched. The School Health Program was initiated. National Goiter Control Program was launched. Goiter is controlled due to the deficiency in the thyroid hormone. District TB Program was formulated. In the year 1963, Applied Nutrition Program was launched. Defense Institute of Physiology and Allied Sciences was set up. National Institute of Communicable Diseases was inaugurated. The National Trachoma Control Program was launched. The name Contributory Health Service Scheme was changed to Central Government Health Scheme. Extended Family Planning Program was launched. A drinking water board was set up. The Chada Committee established a norm of one basic health worker for every 10,000 population. Coming to the year 1964, the National Institute of Health Administration and Education was opened in collaboration with Ford Foundation. A committee was set up under the chairmanship of Shantilal Shah to study the question of legalizing abortion. Coming to the year 1965, the director ICMR recommended Lippi's loop as safe and effective for a mass program. Reinforced extended family planning was launched. Direct BCG vaccination without prior tuberculin test on a house to house basis was introduced. Coming to the year 1966, Mukherjee Committee was constituted. A separate department of family planning was constituted in the Union of Ministry of Health to coordinate family planning program at the center and the states. International Postpartum Family Planning Program was started in Delhi and Trivandrum. Coming to the year 1967, Madhok Committee was constituted. A small family norm committee was set up. Coming to the year 1968, the Small Family Committee's report was submitted. A bill of registration of births and deaths was passed by the Parliament. The Medical Education Committee was appointed by Government of India. The fourth five-year plan had begun from the year 1969. The name National Institute of Nutrition Research Laboratories was changed to National Institute of Nutrition. The Central Births and Deaths Registration Act 1969 was promulgated. The report of Medical Education Committee was submitted. Coming to the year 1970, All India Hospital Family Planning Program was started. The Population Counselling of India was formed. Chittaranjan mobile hospitals were installed. The Registration of Births and Deaths Act in the year 1969 came into force from the 1st of April. The name Demographic Training and Research Center, Bombay, was changed into International Institute of Population Studies. Coming to the year 1971, Family Pension Scheme (FPS) came into force. The Medical Termination of Pregnancy Bill was passed by the Parliament. The Medical Termination of Pregnancy Act came into force on April 1, 1972. National Service Bill passed. The National Nutrition Monitoring Bureau was set up. Coming to the year 1973, the National Program of Minimum Needs was incorporated in the fifth five-year plan. Qatar Singh Committee submitted its report. In the year 1974, the fifth five-year plan was started on April 1st. Reports of the second in-depth evaluation committee and consultative committee of experts on the National Malaria Eradication Program were submitted. The United Nations designated 1974 as World Population Year. Parliament enacted the Water Prevention and Control of Pollution Act 1974. Coming to the year 1975, India became smallpox free on 5th July 1975. Integrated Child Development Scheme had begun. The ESI Act was amended. Cigarettes Regulation Act 1975 was passed by the Parliament. Srivastava Committee submitted its report. The National Cancer Control Program has begun. Coming to the year 1976, Indian Factories Act of 1948 amended. The Prevention of Food Adulteration Act 1975 came into force on April 1, 1976. If you remember, recently in Telangana state, all over Telangana, the food adulteration raid was on throughout the April. The Equal Remuneration Act 1975 was promulgated. New Population Policy 1976 was announced by the Union Health Ministry. The National Program for Prevention of Blindness was formulated. Coming to the year 1977, smallpox eradication was declared. National Institute of Health and Family Planning formed. Rural Health Scheme was launched. Revised Malaria Eradication Plan was implemented. World Health Organization adopted the goal of health for all. In the year 1978, Parliament approved the Child Marriage Restraint Bill. In the year 1978, fixing the minimum age at marriage 21 years for boys and 18 years for girls. The EPI was launched. So, EPI stands for Extended Program of Immunization, which was launched in the year 1978. The Declaration of Alma Ata underlined the primary healthcare approach. In the year 1979, the World Health Assembly endorsed the Declaration of Alma Ata on primary healthcare. In 1980, smallpox was officially eradicated from the entire world on May 8, 1980. The sixth five-year plan was launched, that is, from the year 1980 to 1985. Coming to the year 1981, a new census was taken. The Air Act of 1981 was enacted. In the year 1982, National Health Policy was announced by Government of India. Blindness was included in the 20-point program. District mental health program had begun. The National Cancer Registry program had started. In the year 1983, Impact India was launched. The National Leprosy Control Program is called as the National Leprosy Eradication Program. The Medical Education Review Committee submitted its report. The National Health Policy was approved by the Parliament. Gunia Worm Eradication Program was launched. In the year 1984, the Bhopal gas tragedy had occurred. ESI Bill 1984 was approved by the Parliament. Workmen's Compensation Act, the 1984 Act came into force from July 1st. The Juvenile Justice Act 1986 came into force. In the year 1985, the 7th five-year plan 1985 to 1990 was launched. Universal Immunization Program was launched. The Leprosy Act 1898 was repealed. In the year 1986, the Environment Protection Act, the 1986 promulgated. Juvenile Justice Act 1986 came into the force. In the year 1987, a new 20-point program was launched. Worldwide Safe Motherhood campaign was launched by World Bank. The National Diabetes Control Program and National AIDS Control Program initiated. In the year 1989, Blood Safety Program was launched. ESI Act got operated. Mahila Samakhya Education for Women's Equality was launched. In the year 1990, Control of Acute Respiratory Infection ARI program was initiated. In the year 1991, India stages the last decadal census of the century. Coming to the year 1992, 8th five-year plan, that is from 1992 to 1997, was launched. The Child Survival and Safe Motherhood Program CSSM was launched. 1993, revised National Tuberculosis Program with DOTS got introduced. In the year 1994, return of plague after 28 years. Panchayat Raj Act came into the force. In the year 1995, ICDS renamed as Integrated Mother and Child Development Services IMCD. Legislation on transplantation of human organs was enacted. Expert Committee on Malaria submitted its report. Coming to the year 1996, Pulse Polio Immunization, the largest single-day public health event, took place on 9th of December 1995 and 20th January 1996. Second phase of Pulse Polio was conducted on 7th December 1996 and 18th January 1987. The Prenatal Diagnostic Technique Act 1994 came into the force. In 1997, Reproductive and Child Health Program launched, which is also called as RCH. Ninth five-year plan was launched. RNTCP was launched. Coming to the year 1998 and 1999, NFHS 2 undertaken covering 90,000 women aged 15 years to 49 years. National Malaria Eradication Program named as National Anti-Malaria Program. Phase 2 of National AIDS Control Program became effective. Coming to the year 2000, National Population Policy 2000 was announced by Government of India. Coming to the year 2001, India stages first census of century. In 2001, Dular project was started in Jharkhand to combat malnutrition, infant mortality, and poor maternal health. In the year 2002, National Health Policy 2002 and National AIDS Prevention and Control Policy was announced. Coming to the year 2003, NVBDCP National Vector Borne Disease Control Program was launched. Coming to the year 2004, the Reproductive Child Health Program had just begun. IDSP Integrated Disease Surveillance Project was launched. In the year 2005, the National Rural Health Mission started. RCH Program 2 was launched. Janani Suraksha Yojana was also launched in the same year 2005. Coming to the year 2006, RNTCP Phase 2 was launched, which was from the year 2006 to 2011. Public Health Foundation of India was established. Coming to the year 2007, NACP 3 started from the year 2007 to 2012. National Tobacco Control Program was started. Indian Public Health Standard for Primary Health and Sub-Center formulated. Arogya Shri program was launched in the year 2007. In the year 2009, pandemic influenza A H1N1 2009 outbreak was reported. The Rashtriya Swasthya Bima Yojana RSBY scheme is launched with the objective of providing affordable health care to the poor. In the year 2010, National Program of Health Care for the Elderly was started. In the year 2011, the last case of poliomyelitis reported from West Bengal. In the year 2012, Special Action Plan for 209 high endemic districts, 16 states and union territories was implemented. Janani Shishu Suraksha Karyakram was launched in the year 2012. NSSK Navjat Shishu Suraksha Karyakram was launched in the year 2012. In the year 2013, RMNHCH Plus A program has started. Coming to the year 2014, Mission Indradhanush was launched. Tuberculosis Mission 2020 was launched. India Newborn Action Plan was launched. Coming to the year 2016, the entire country was covered by RNTCP. Coming to the year 2017, National Health Policy 2017 was announced.